computer. All right, so, well, thank you for joining us. And I'd like to have our president start off our meeting officially. And then we'll go from there for holistic health with the 100 Black Men New York City chapter. Audrey Ennis, president.
Okay, fantastic. So now we will continue on with our February favorite things.
Thank you, Reggie.
We're going to just go through some.
And if you're not speaking, please mute.
That you would definitely be interested in. We're going to start with travel.
All right, Reggie, thank you very much. So welcome to the 100 Black Men Fireside Chat around holistic health. Sadly, due to the genetic makeup of Black people, and we are predisposed rather, to many diseases that we succumb to due to misdiagnosis or lapse in healthcare. So I'm very excited that Reggie decided to put this call together. Excited to join in on the conversation as we explore non-Western medicine and healing practices. And hopefully we'll take a deeper dive into healing of the mind and mental health, which has always been taboo in the Black community. So to that, thank you in advance to our members, our guests, and our panelists. You could have been anywhere this evening, but you chose to be with us, the 100 Black Men. So Reggie, the floor is yours.
Thank you. And right now, thank you very much, President Ennis. Right now, we'd like to have another word from our chairman of the Health and Wellness Committee, Dr. Gary Butts.
Thank you very much. And Aldrin, thank you for your kind words of introduction. You're quite right. The unfortunate reality is that people of color are disproportionately burdened by chronic diseases and illnesses of most type. And we as Black men, unfortunately, tend to be at the bottom end of all of what is going on. And so much of the illnesses that we face as a people, as a community, are preventable. And so with that, we aim to engage our members and communities in ongoing fireside chats to inform us in what is the latest and best ways to prevent disease, aim towards better wellness, and of course, perhaps even get to a point where we are more powerfully connected so that when indeed we need support, we can find it. So I've the privilege of chairing the Health and Wellness Committee, along with Reg Miller, who's also on the call tonight, who is the co-chair. And I want to acknowledge other members of the committee, and of course the board, for allowing us to put this panel together. Reggie Pittman, thank you for your leadership tonight. Thank you, the rest of you, members of our committee, for your support and coordination, assistance and coordination this event. And of course, thank you to the 100 Black Men leadership and the board. And finally, I want to thank our panelists, because indeed, yes, you could be somewhere else and staying warm at a real fireside, but here we are. And I think this is a acknowledgement of the importance of this to not just us, events like this to not just us, but to you all, the broader community. And so we look forward to an informative conversation as we engage each other and facts that help us to be smarter and better informed and taking care of ourselves and each other. So I look forward to a wonderful conversation tonight. Reggie, back to you.
All right, well, thank you, Dr. Butts, appreciate it. And definitely a shout out to the whole committee, Health and Wellness Committee, Dr. Butts, Dr. Miller, Anthony Smalls, Rudy Combs, Charles Ruffin, all those that contributed. But we like to just get started and be mindful of everyone's time. So we have 3 doctors that are our guests today. And I want to first of all say thank you for joining us. We're really looking forward to being educated, because they say the best consumer is an informed consumer. So I'll start with Dr. Glenn Gerald. Dr. Glenn Gerald is a naturopath who has appeared on numerous television and radio programs, including NBC, Fox, and many others. He analyzes each individual's health, behavioral, and attitudinal profile to help achieve optimal wellness by referring each client to scientific, historical, and anecdotal healing principles. Dr. Glenn Gerald believes that optimal well-being is a concept of health that goes beyond the curing of illness to one of achieving wellness. These aspects are physical, emotional, and mental. The broader holistic approach to health involves the integration of all of these aspects and is an ongoing process. Dr. Glenn Gerald will not prescribe drugs nor diagnose illness. He is a trained natural health specialist and educator. He performs wellness consultations regarding diet, nutritional supplementation, botanical medicine, exercise, mind-body imbalances, and alternative healing. Welcome, Dr. Gero.
Thank you, Reggie, for inviting me. I appreciate it. And you know, I enjoy these. So,
yes. We're really looking forward to having you here. I really appreciate you carving out some time for us.
And I should be an honorary member.
That's true. So we'll talk about that. I might send you the application, man.
Okay.
Dr. Zorina Costello is our guest as well. Dr. Zorina Costello has a doctorate of ministry with a specialization in pastoral counseling and pastoral theology, and a master's of science with a specialization in clinical counseling. Dr. Costello is the chaplain and director of community engagement, the Center for Spirituality and Health, the Center for Stress Resilience and Personal Growth at the Icahn School of Medicine at Mount Sinai. Dr. Costello, welcome. Thank you for joining us.
Thank you so much for having me and for presenting the opportunity for this forum for us to be engaged in this very significant and timely conversation. I'm looking forward to what goes forward. Thank you.
Thank you. And our other guest is Dr. Tyran Mincey. Dr. Mincey is a clinician and lecturer on issues involving humanity and the drug-free quest for health and wellness. His lectures encompass education, workplace productivity, and working towards reaching our star-high potential in anything we undertake. We must understand the foundation that health plays in all of our lives' activities. Dr. Mincey is a devoted husband and proud father of 4. We agree on a few things, but definitely being proud fathers. So Dr. Mincey, welcome as well.
Thank you for having me, and I'll just echo what the other 2 doctors said. It is definitely something that we need to be talking about, and it's something that I talk about often in the office. That is the health of Black males.
Yes. Well, let's get started. Our first question, for those people that have questions, I'm not sure if you're not one of the guests, please mute. So that would be helpful. Thank you. If you have questions, put them in the chat. I'll read those a little later. But all of our members had opportunities to submit questions. If for some reason you did not get that opportunity, or you're not a member, you can put it in the chat, and then we'll go from there. So we're asking that you stay muted, and then we'll read some of the questions from the chat. But we'll start with the questions that were submitted either by the committee or by the 100 Black Men's membership at large. First question: stress is a primary contributor to poor health. How do we reduce stress and continue to have a high quality of life? I'm going to ask Dr. Costello if you would like to start. If you'd like to say something about yourself before you answer that question, that would be fine as well. But that first, you deal with stress resilience. So I think that would be right down your alley.
Well, one of the ways that we can help to increase our resilience is by doing exactly what you're doing this evening, by being in community, by getting the support of like-minded brothers and sisters who realize that we need to be in conversation, we need to be doing healthy activities together. We need to be not necessarily worshiping together, but sometimes that is significant too, but having a way of coming together that is communal, because that is part of our ancestry. That's part of our heritage. We are a communal people. And so when we find ourselves isolated, disconnected, especially during a time like this where a pandemic has impacted all of us significantly, seeking ways to be in community and to take care of ourselves, mind, body, and spirit, is something that we should really emphasize. And so whether that means being with family, improving our diet and nutrition, I'm sure others are going to talk about that, increasing our opportunity to be out in nature, to be around trees, to be around sand, to be around water, that can help us reduce our stress and be more in touch with a peace of mind, and developing ways to be in touch with our inner spirit.
Thank you. Thank you. You know, you talk about the community, and we do have a community of brothers that we all join for our 4 pillars, one being health and wellness, the others are education, economic empowerment, and one more, mentorship. So those things are very important to our organization. But you mentioned something about community, and we know there's these blue zones, and the blue zones, there's 5 in the world, right? Japan, there's one in California, Costa Rica, and a few other places. And they talk about a few things. They talk about and people there live to be over 100 years old. And not only are they centenarians, but they're also healthy, right? So you can be 100, but you can be in a wheelchair and, you know, not breathing, an oxygen tube, all that, you know, but they're healthy 100-year-old people. And they said there's a few similarities in all these blue zone areas. They said that they are 95% plant-based nutritionists, right? That's what they eat. They stop eating when they're 80% full. And then they live, the grandparents live with them. So they have a sense of community as far as that's concerned. So the question is, how can having your grandparents or older relatives live with you to improve your family's life? And I'll just open that to anyone of the doctors that would like to answer that. I'm going to go to Dr. Oh, go ahead, Dr. Costello.
Really
nobody jumped in, so I was going to volunteer someone.
There's 2 items here that that you're addressing: the blue zones and a lifestyle of living with the extended family, the older folks in our communities who are our grandparents, our aunties, our uncles, etc. For those of us who still have those folks, because they are sources of wisdom. However, what's impacting a lot of us, we here in the United States don't live in one of those zones. And so we actually have to conduct ourselves in a very countercultural way, because we're living with advertising of all kind of foods, all kind of various ways in which our environment is polluted. And so we really have to be proactive about getting involved in movements to change policy about the environmental pollution, which, you know, impacts our health and can lead to other diseases. And so that's one of the things that we have to be aware, that we don't live in those zones, but yet family members who are wise, who are older, who have aged, because probably they grew up in a time when there weren't so many additives and chemicals in the environment, have had the opportunity. I know my grandparents lived well into their 90s, but they grew up in rural places in Puerto Rico where they didn't eat much meat, and there were no additives to the food, and no pollutants in the farmland. So all of these things contribute to how healthy we are or can be.
All right, well, thank you. You brought up a number of points as far as the family and living together. our area, New York City, that we're located in. And Dr. Mincey, I'm going to come to you for this one. There's a lot of information out there that people can receive. Some of it is good, some of it's not good. The question is, what are the best sources of reliable information regarding holistic approaches to health and wellness?
Well, that's actually kind of difficult, because when we say something's holistic, there are many, that's an overarching term for a bunch of professions. There's naturopathy, there's chiropractic and applied kinesiology. I mean, we could go on and on and on, and there are definite alternative therapies. So the question does come up oftentimes, who can you trust? And the one standard that we have, although it's not absolute and not perfect and doesn't cover everything, is referrals. The next standard would be licensed individuals, but that's not necessarily fair to our naturopathic brethren, who sometimes in some states are very, very competent, but not licensed in those states. So I tell people, usually you have to go in and meet with people and vet people. And unfortunately, in this field, as it would apply to just about every other field where you're purchasing something or spending money, it's always buyer beware. So there's the telltale place that you go to get information are the scientific journals, but they're so difficult to read that they're really not for lay people. And sometimes the scientific journals have been tampered with, especially in our latest unfortunate series of events leading up to COVID-19. So we saw in that journal, one of those journals was tampered with, and they planted false information in there. So when you start looking at the trusted sources, I'm sorry to report to you that there aren't a lot except referral, word of mouth, licensure, and perhaps doing vetting yourself.
All right, great, thank you. So source to get a reliable source of information is a referral. That's really easy if you're in New York City, but if you're in a rural area, then that might be quite difficult, right? Because you might not have access to someone because you're living in a more rural area. So Dr. Gero, I know there's a number of naturopaths, and you have things online that you can find out about a doctor, any doctor, about the general naturopath definition. So why don't you help us out and tell us a little bit about what is a naturopath? What's the difference between an herbalist, a holistic doctor? What those terms are, and are there additional ones as allopathic doctor? What those are, and how should someone choose a person? And just give us that basic information.
Okay. Well, basically, naturopathic medicine is about looking at the individual and what that individual needs. And as metaphorically, I can tell you that this would be interesting. Let's say somebody's driving down the highway, and all of a sudden the check engine light goes on in their car. So they pull into this fancy gas station with all the fancy lights, and he says, my check engine light is on. They take the car in the back, they snip the wires to the check engine light, and you get the car back and the symptom is over. There's no more check engine light, but they didn't solve the problem. Not realizing that a little further down the highway, there was another gas station. It wasn't as fancy, but they actually they drove the car into the garage and they analyzed what was going on, why the check engine light went on in the first place. They corrected the problem. So I feel that in many cases, what conventional medicine does is they're dealing with symptoms, and they're snipping the symptoms. They're making somebody maybe feel a little bit better, but they're not taking into consideration the consequences of the conventional approaches. I'm not saying that all conventional approaches are not legitimate, but when somebody comes to a naturopathic doctor, what we want to be able to do is ascertain what is causing the problems. For example, if somebody's going to a gastroenterologist because they've got bloating, they've got gas, and they've got a number of other things, the gastroenterologist says, you've got IBS. And I had somebody yesterday says, I went to a gastroenterologist and my symptom is IBS. What is IBS? Irritable bowel syndrome. Is that a disease? No, it's a collection of symptoms. Patients of mine have gone to gastroenterologists. I have one patient that's gone to a gastroenterologist for 15 years. She has the same problem today that she had 15 years ago. Mm. She came to me with the same symptoms of bloating and gas. I gave her remedy, an herbal antimicrobial, and she was better in 5 days.
Wow.
She said to me, you know, I have another appointment with my gastroenterologist next week. Should I keep the appointment? I said, absolutely. Tell him, why is it that I've gone to you for 15 years and you haven't helped me? In fact, I'm worse today than I was 15 years ago when I go to a holistic doctor, and after 5 days, I'm better. I feel better than I felt in 15 years, because what I'm doing is looking at what is creating the problem and treating the problem rather than suppressing the issue. So oftentimes a remedy that a medical doctor is going to give somebody, an antibiotic or a proton pump inhibitor, may make somebody feel better tomorrow, but they're going to get worse because of the consequences of using that drug. I'm not against drug therapy when it's necessary, and there are many drugs that are life-saving. But unfortunately, many of the drugs that we use in this country are making people worse. And just as an example, the United States comprises about 5 to 7% of the world population. We consume, as a nation, nearly 50% of the world's drugs. When we look at the top 50 industrialized countries in this world, we rank 47th out of 50 in terms of the quality of the health of our citizens. If the drugs were working, we would be first. Well, additionally, we consume about 70% of the psych medications, and there's more psychological issues, anxiety and depression in this country than any country in the world. And we're consuming 50% of the world's drugs. So what does a naturopathic doctor do? We want to find out what is going on with that patient. I know I exceeded my 2 minutes.
Listen, that was very good information. Some of that I didn't know. The 50% of us, we take most of those pharmaceuticals. It's interesting, and we're only 6% of the population. That's interesting, as well as psych drugs, 70% of those. That's very interesting. But that leads to my next question, which is, how can the holistic health community help the allopathic community, right? The doctors that prescribe those drugs, in terms of finances, right? Not in terms of just health, but in terms of finances. Many allopathic doctors, they fear naturopaths because they lose money. So how can this marriage work? I think of Oscar and Felix, right? They weren't married, but they were roommates and totally opposite, but they figured out how to coexist. So I'll just open that to anyone that like to address that issue. How can naturopaths and allopathic, which are traditional doctors here in the United States, financially come to an agreement that'll help the people?
They could.
Go ahead.
They can.
I have strong opinions on this, but I'd like somebody else to start.
Yeah, I do as well. I think that there's a competition. There's no two ways about it. We are in competition. Sometimes to a lesser degree, because generally what should happen is there should be a natural, orderly approach to healthcare. You should start with the most least invasive therapy, and then you grow into more invasive therapies as things fail. So we're really not in competition, because the issue is that people are skipping the basics and jumping to the allopathic way. If they just started off with the basics first, I tell people all the time, you're coming to me 15 years later. Where were you before? You're coming to me because all these other things failed when you failed to start off with the basics. So the reality is none of us knows everything. Having a team is probably the best approach. And that team should operate in the method that starts off with least invasive, graduates to more invasive. And graduates to more, that's okay. That starts off with least invasive and then graduates to more invasive. And some of this falls upon the responsibility of the patient. You know, the patient has a role in this too, because they have to demand a certain type of care and they have to have a team as well. So it's not just the doctors. And the reality is more people visit alternative healthcare providers. That would include naturopaths and holistic providers than they do primary care. And that trend has been going since 1998. It's been on fire and it continues to grow exponentially. And so we're all aware of this. It sometimes seems like the medical establishment isn't, but we all know people who go to different types of alternative doctors because mainstream medicine missed the need or didn't have that need. So I think that conversation is somewhat difficult, but I'm always willing when a patient comes in to do what's right for the patient. My philosophy is never put before the good of the patient. So I tell patients all the time, if you need me to be on your team and communicate with your primary healthcare provider and communicate with any provider that you have, I'm more than happy to do it. Oftentimes, they don't want to communicate with me though.
Before I jump to Dr. Gero, you're saying that over 50% of the people in the United States go to a naturopath more so than they go to an allopathic doctor?
Yeah, there was a wonderful study. They started tracking, a guy named Eisenberg started tracking, they call it trends in alternative healthcare. And more people in this country go to alternative providers than they do primary care providers.
Is that based on where they live, or is that just a general?
They conducted this in surveys. I think the surveys were 94, 98, and then I think in 2003. And if any of you other docs know the exact dates, please chime in because I don't remember them all. But they did these surveys to try to, they called it trends in alternative healthcare. And when they finally did this study, I think in probably the early part of the 2003, 2004, the medical schools started offering more alternative healthcare education because they started saying there's a trend here. And, you know, medical doctors take about 2 hours of nutrition and sort of alternative therapies in their whole education. And this isn't a bash on them. Everybody can't know everything, but I think it's important that everybody know, it's always important when you have conversations to know who you're talking to.
Yes.
Not just because somebody has letters behind their name doesn't mean they know what's happening with you. You know, I'm sure Dr. Gero will also agree with me. I get up daily and study articles in the literature on nutrition and herbs and vitamins. I can't even keep up with it for 25 years. So there's no way you could possibly learn all the drugs, all the medications, all the surgeries, and then be an expert on nutrition as well. It's just not possible. So that's why I say a team approach is important. And then realizing that there is a competition, but you have to start from least invasive to most invasive. And it's reflected in the stats. That's why more people were going to alternative providers than there were to primary healthcare providers. Okay.
All right. So the trend is trending toward natural medicine. Dr. Gero, I know you wanted to get in here about the finances and competition, or the issue with maybe not a competition, but the issue of having the choice of either going to a natural doctor or going to a doctor that's going to prescribe possibly pharmaceuticals.
Right. Well, man, Dr. Mincey, I love everything you say, and the way you say it is great. You know, I really enjoy listening to you. One correction. I think conventional medicine in the pharmaceutical industry is semantics. Let's make something very clear. Natural medicine is not alternative medicine. because I'm not the alternative. Because eating right, exercising, thinking appropriately, and sleeping appropriately has never been the alternative. If people don't do the natural things that keep them healthy, the alternative and the true alternative is drugs and surgery, and that's conventional medicine. So it's the medical doctors today that they are the true alternative to good health. And unfortunately, medical doctors are not trained as health practitioners. And I lecture at Rutgers Medical School. And one of the things that I ask, first thing I ask is, how much nutrition training do you students get? And the answer is 1 afternoon or 2 hours. So 85 to 90% of all diseases are probably associated with nutritional deficiencies or imbalances. And we look at heart disease and we look at diabetes. These are totally preventable diseases. 90% of heart disease, diabetes, and Alzheimer's is preventable with good lifestyle. Now, medical students go to medical schools with great ideals. They're incredibly idealistic. They want to heal the world. But when they graduate medical school and they do their internship and they do their residency, they're slapped in the face with the medical industrial complex. And you know, if going to medical doctors today, and any medical doctors that are on this panel realize that you cannot be in medical practice anymore, or it's very difficult to be in medical practice unless you are a member of the Summit Medical Group, the Valley Medical Group, the Hackensack Medical Group, the Atlantic Medical Group, and you're paid on commission. And you can get fired because you're spending too much time with your patients. You can get fired because you're not seeing enough patients in the course of a day, because you're not worth anything to the medical industrial complex anymore. And who's the one that suffers is the patient. So somebody comes to me, and I'm not saying I'm the greatest doctor in the world, but I spend an hour to an hour and a half with a new patient. Reggie knows that. Because I need to find out what's going on with the patient. When you're seeing a patient for 5, 10, 12 minutes, if you're lucky 12 minutes, there's no way any doctor, I don't care how smart they are, is going to know what's wrong with you. And you're walking out of the office with a sense of frustration and a prescription that for a drug that you don't know what it is, what it's used for, and what are the consequences of that drug. So it's not a competition, or it shouldn't be a competition, because there's a need for good medical doctors. I used to publish some of the top medical journals in the world, including the Annals of Internal Medicine, the American Journal of Surgery, the American Journal of Cardiology. I was the vice president of the American Heart Association here in Passaic County. I've studied at Harvard Medical School. So I understand the plight of today's medical doctor. I don't blame the doctors. It's the system. 40% of the revenues that go to medical schools are supported by the drug companies. So what is the paradigm that is being taught to medical doctors? It's not let's eat right and let's exercise.
All right, so if you have a question, I see some hands are up. Type it in the chat. We're going to get to questions. But you bring up a few different things, an interesting concept. And I have to say that, Dr. Gero, I came to you with prostate cancer, and you gave me a natural path to heal my prostate, to improve my health. And what is this, 13 years later, I'm doing great. So I want to thank you publicly for that. I've done that well. And the book that you asked me to write is finished. Well, almost finished. I did another one on the way. Once you start eating right, your mind clears up, and I've been so much more productive. There is you brought up something about a few things. One, that the the natural way is the best. Well, you didn't say the best way, but that's a more thoughtful approach, or the approach that most people should take. And then if you go the conventional way, then that's the alternative. That's an interesting way of putting it. But you brought up something about sleep, and I want to ask all of three of you, how important is sleep, and how much should you get? If you're eating healthy, do you need less sleep? If you're in certain areas, Alaska or closer to the poles where you have less light, do you need more sleep, less sleep? So, and how important is sleep as well as far as health is concerned? And I'll just ask any of you to answer that.
Well, I'd like to address that, please. And based on what the previous doctor said, I've had an opportunity to be involved in writing a chapter in a book called Lifestyle Medicine. The chapter that I addressed was on spirituality, but overall, lifestyle medicine does address living a lifestyle that is going to be conducive to better health. Now, this is a countercultural way of thinking, because the pharmaceutical companies and all these other elements are constantly trying to tell us that we need this drug or we need this certain medication in order for our lives to be better, especially in the area of psychotropic medications and other medications as well. Sleep hygiene is a particular set of behaviors that people can adapt in terms of, going to bed at a certain time, making sure there's no lights on in the room, which is very difficult with all the electronics that we use today. There's, little lights all over the place. Really developing these better habits at living, better lifestyle habits, which overall, a lot of people don't want to do. And one of the things we do within the Center for Spirituality and Health and the Center for Stress Resilience and Personal Growth is educate the community. Now, the education is going to hopefully create better consumers of whatever medical or non-medical ways of living life, the exercise, the diet, how to shop, how to advocate for oneself, how to survive within a food desert. All of these things are part of living a healthier lifestyle. And our culture kind of teaches us that we should have a quick fix to everything. So people have to begin to really look at their lifestyle, see if they're taking time to develop these better habits, making behavioral changes that are going to lead them to a healthier path.
So as far as sleep, thank you for that. As far as sleep, how many hours should a person get a day? What's your thoughts on that?
Well, I think the literature shows that adults should be getting at least a minimum of 7 hours of sleep, which many of us don't get for a variety of reasons. Again, it's training the body to go to bed at a certain time, to stop watching television, to relax, and maybe doing some meditation or prayer before bedtime, eliminating drinking liquids at a certain time. There's a whole set of behaviors that people can learn to do in order to have better sleep hygiene.
All right, Dr. Gero, Dr. Mincey, any comments on how much, thank you, Dr. Costello, how much sleep a person should get in order to become more healthy?
That's a really big question. What we do know, I guess we can answer that. There are a number of factors that impact a person's ability to sleep. And if a person's going to heal, they have to sleep. And it's a major issue. It's one of the first things that we try to deal with when patients come in, is making sure they're getting a good quality of sleep, because especially the first 1.5 hours, you make growth hormone, and that allows you to heal as you go through the night. And if you're eating late meals, doctor talked about sleep hygiene. If we're eating late meals and we're doing all kinds of things before bed, we suppress that growth hormone. And then when we wake up the next day, we haven't healed. As a matter of fact, we've aged. And that's how disease progresses over time. And there are a number of hormones and stressors and cell phone waves and other factors that disrupt sleep. So if you're not sleeping, it should be a number one priority to get that addressed and handled naturally, starting off the basics, not with Ambien and certain medications. You've skipped the basics, like I said earlier, but going back to just like blocking and tackling and making sure you're eating properly and you're eating and you're exercising the way you're supposed to, and you're not eating after 8 o'clock, and you're not doing a whole list of things that I don't have enough time to even talk about. But you can change these things. Some things are harder than others.
Well, thank you. Well, you know, you're a kinesiologist, and we didn't really, and that deals with healing as well. Body mechanics, back pain, sore joints, how you use your body. So can you just tell us what kinesiology is?
Well, first, yes, kinesiology is not what I do. I'm what's called an applied kinesiologist, but sometimes people make the mistake of mincing the two together, and they say kinesiology and they say applied kinesiology. Kinesiology in and of itself is the study of movement, and that's pretty impressive to study someone's movement. But applied kinesiology is the application of alternative therapies to the correction of abnormal movement. And that abnormal movement is a reflection of what's happening on the inside of the body. So we use the outside of the body to allow us to see inside the body. So if a muscle hurts, it might hurt because something's wrong with the muscle, but it might hurt because something's wrong with an organ that's associated with it, or because you didn't get enough sleep. So there are a bunch of factors that we take into consideration when we talk about applied kinesiology, but you will hear lots of stuff in the public where people call it kinesiology. There are definite differences.
All right, great. We have a few questions in the chat. So before we continue with these questions, I think Gary or Anthony, who's monitoring the chat, can you just unmute and ask the question, please?
Yes, good evening, everybody. The first question we have in the chat was, how do we get the medical community to start with the patient's needs first?
That's a good question. I'm not sure any of us could really, it's consumer driven. You have to demand it. And if enough people demand it, it will change. But if people don't speak up, then you have drug companies and you have the whole medical economic complex ruling and drug companies ruling the day. It's really up to the consumers. And you can see when I talked about people visiting alternative providers more than they do primary care providers, it's a driving force. The people are going to be the thing that changes it. You should have to demand that your doctor do what you believe is right.
I couldn't agree more. You're absolutely right. It has to be consumer driven, because take, for example, a patient that goes into a conventional doctor's office and waits for an hour to an hour and a half to see a doctor. Whose fault is it? Is it the medical doctor's fault? Is it the medical staff's fault? Or is it the consumer or the patient's fault that they're putting up with that? If everybody thought like I do, and we had a 35-minute rule, because if I call up and I say, listen, if I have to wait more than 35 minutes, I'm walking out. In my office, I don't think anybody ever waited more than 5 or 10 minutes to see me. They sometimes have to wait 3 weeks to see me, but not my waiting room. But you know what? You're so right, because if we're putting up with what conventional medicine is throwing at us, they will continue throwing the same thing. And if the consumer or the patient's demands are such where we are looking for other avenues of getting well, then the system has to change, because people are not going to support these primary care doctors anymore.
And you know what? It actually has changed in the 25 years or so I've been in practice, because you had medical doctors that were polarized, and at first so-called alternative therapy didn't work. And then all of a sudden you had people that were integrative, right? Because being holistic was a little bit it was too far over here. So I do think you're starting to see that, because you get more and more medical doctors that are integrative and looking at, giving some validity. We're not there yet. We're not even close, but I do think it has changed. And I think that's because consumers are looking for it.
Well, one funny story. When I started my practice about 25 years ago, somebody asked me, he says, how long do I have to wait before I can see you? I said, where are you now? now people are waiting 3-4 weeks to see me. So I mean, things have changed. You're right.
All right. So Dr. Mincey, is an interesting thing you said. Kinesiology and applied kinesiology are two different things. I didn't know that. That's very good information.
Yes.
Gary, we had another. I see we have a few things in the chat. So if you could, before I ask some of these questions I have, if you could ask another.
Yes. Next question is, how did the pressure for speed or getting as many patients out the office begin?
I can tell you that. when I first started practice back in 90, whatever, I wasn't in any insurance, and patients would come in and they would say to me, we want you to accept our insurance because that would be great. And at that time, I didn't have any real restrictions. I would just bring people in. My collections at that time were 100%. Well, I took the patient's advice and I started accepting insurance. And then I would submit my bill to the insurance carrier, and I'd submit a $100 bill and they'd give me $35. Well, now that 15 or 20 minutes that I just spent with you, I can't do anymore because I can't survive off of $35. And so patients have no clue sometimes how difficult it is when you accept insurance. Then on top of that, the insurance carrier puts in there in the contract that you may not offer anything that we don't pay for. So now I have 50 services that I can offer a patient to help them. It's been reduced to 3 or 4.
Okay. I'm speechless. That's a tough one. I've heard doctors, dentists specifically talk about, only getting, 10 to 30% of whatever their bill is. So I don't know. Does anybody else want to comment before we move on? We're trying to stay within a certain time frame here. All right, we're gonna move. Listen, I have a question from a member. It says, how can the holistic health community help that's the wrong one. This is the question. What would be your suggestions for someone who is trying to reverse their high blood pressure or diabetes and wean off their medication?
Well, I could answer that because I do it all the time. First of all, you have to really assess what is driving the blood pressure. There's a lot of issues that are associated with high blood pressure. It could be a magnesium deficiency, and I do hair mineral analysis because it's a depiction of what's going on in the body tissue. And probably 80% of the people are magnesium deficient. I had a fellow that had a blood pressure of 210 over 120. We got him down to 120 over 80 in a month just using magnesium glycinate. He also had an A1C of 12.8. We got him down to 5.4 without any medications. It's all lifestyle. Part of my training was at the Joslin Diabetes Center associated with Harvard. And they talked about that whole session at Joslin Diabetes Center. There was not mention of a drug, not one mention of a drug. We're talking about lifestyle implementations, diet, exercise. They took 2 groups of people. They exercised one group 150 minutes a week. They took another group and exercised them 300 minutes a week. There was an appreciable difference with the people that exercised. So we don't have enough time for me to really expound upon this, but people don't move. People are creating many of their own problems. And yes, I agree. And since this is a 100 Black Men organization, you have to know there is medical bias. Whether the doctor is black or white, they're trained. If your A1C is a 7 and you're black, that's okay. If you're a white man or a white woman and your A1C is 7, that's not good. And this upsets me to no end.
Well, I don't think a lot of people know what A1C is. I know one.
This is a marker of how you're regulating your blood sugar levels over a 90-day period. And in this country, I don't know about other countries, black patients and white patients are treated differently. In my office, everybody's treated the same. And if you have an A1C above 6.5, you have diabetes. I don't care what ethnicity you are.
You know, you bring up points about numbers and the quality of what your numbers should be, right? So if you have a different melanin, then your numbers might be different if you're Caucasian. And I know with prostate health, you have certain numbers that indicate that you might have prostate cancer, BPH, benign prostate hyperplasia, or prostatitis. Do those numbers change based on your race as well, as far as prostate scores?
I don't think so.
Okay,
no, because
so
if you're doing a biopsy, the biopsy is really looking at how many of those 12 sections have a malignancy, have a cancer cell. I don't think it's going to differentiate there, but I think there's too much of an allowance with blood pressures and too much of an allowance with blood sugar levels. And I don't think it's right, because there should be one standard. We are virtually, except for skin color, we are identical.
I know at the beginning, I don't remember who it was, somebody said that we are genetically predisposed, and that remains to be proven. What it is over a lifetime, how we live, what we eat, how much we exercise. It's all of that combined. There's no evidence that we who are more melanated are genetically predisposed. Now, if you were to begin your life living a healthy lifestyle, eating a plant-based diet, exercising, over time, when you reach a certain age, you're gonna have less disease than someone who decides at the age of 40 or 50, oops, I've been doing this all my life, I better switch up and change now. You know, you've had a lifetime of the cells, what's the word? The cells are starting to
mutate, get injured.
Exactly. So it depends on what point in your life you're deciding to make these changes. That's also a critical piece of this. So we can seek, natural ways of healing. But let's be real with everybody. We need to educate the community and get people asking the right questions, knowing what their numbers are, and challenging physicians who are telling them that this is okay for the numbers to be at this level, and not offering them a natural alternative to bring the numbers down.
I'm going to move to another question before we go to the chat, because we're rounding up to the top of the hour. This is about prostate health too. If there's one thing that a person, this is 100 Black men, there's one thing a person, I'm going to ask each of you to answer this. There's one thing a person can do to prevent prostate disease, whether it's prostate cancer, BPH, or prostatitis. What one thing would you recommend? If there is one thing, what one thing would you recommend?
Vitamin D.
Huh, I was going to say that.
I'm sorry.
All right, so we have two doctors saying vitamin D. That's a good sign.
Just 1 point, 70% of all prostate, breast, and colon cancer can be reduced just by having adequate levels of vitamin D.
That's right.
Spot on.
All right, so brothers, you heard that, vitamin D. But let's say,
I got to say one thing about this, right? Because everybody's looking for the magic bullet. There really isn't a magic bullet. So
You're right.
You can go out and take vitamin D. But if you go out and you take vitamin D for a long time, you're probably going to have a calcium deficiency. So it makes sense to have people on your team that can guide you and make sure that you're applying this little bit of knowledge that we gave you in 30 seconds correctly.
Good point. Good point. So vitamin D is just part of it.
You did ask for one thing.
I asked for one thing. I just wanted one thing. Let's go to another question in the chat, and then we're going to about wrap it up.
Okay. How do you believe income affects the quality of life and nutrition that one can attain?
Wow. You know what? About 2 or 3 years ago, a grant writer wrote a grant, and that grant allowed inner city people who really wouldn't have had the means or the ability to come see me. There were about 10 of them. And so they didn't have very much money or anything. And I was shocked, horrified. I couldn't believe what I saw. They were prescribed medication that they never needed. They were told that they had diagnoses that they didn't have. As a matter of fact, I think 9 out of 10 of them, we got off of just about every drug they were on.
Wow.
And it just blew me away that people were getting such poor care. So I think if you don't have money to pay, unfortunately, and I don't know if it's because you're not educated properly, I don't know all the answers, but I know it doesn't seem like you get the same care.
Yeah, I'm not sure if it's really,
there's a socio-political aspect to all of this, and we don't have time to get into it here. Based on various zip codes where people live, the type of medical care or access to care that they get is going to be vastly different from other zip codes. So income does have a huge impact, but so does all the other stressors in this society that are impacting us on a daily basis. That being said, because we are running out of time, I do want to stress that one's belief system in terms of your inner spirit, your inner being of who you are, it's very important for us to be in touch with. So whether we do that through prayer or being in community, through meditation, through breathing, is very important for us to learn these techniques, which I don't have time to get into here, but that also can lower stress, can lower blood pressure and other ailments that we suffer from. So slowing down, even in the midst of all this chaos that we're in, is really important to help us to become healthier.
It's really an educational issue. It's not a socioeconomic factor, because you could be poor, but if you're educated, you understand all of the things, and you guys touched on it perfectly. It's really understanding what you need to do to stay healthy, and it's really knowledge-based.
Dr. Costello, you brought up something about prayer, spirituality, which is obviously different than religion, right? So with prayer, do you feel that prayer do you feel that prayer could actually heal a person based on whether it's diabetes, high blood pressure, prostate? How do you feel the spiritual awareness helps a person as far as any diseases they might have?
Well, if we're talking about holistic medicine and lifestyle medicine, prayer can be a component towards a path to healing. It's not just prayer in and of itself. It's not just blind prayers, but it's prayer to empower oneself about how to live a healthier lifestyle. And then asking one's higher power, God, or however it is for, let's say for Native Americans, they're very in touch with the earth. What is it that's important to you from your community that you could grasp onto that's healing and holistic? And so prayer could be a part of that, but it's not just that in and of itself. But faith does, faith has done a lot for people, but also faith within a context of community. Right now, the society, many people are suffering from isolation, from loneliness because of the the ravages of COVID. And so we have to continue to know that we need to reach out to one another, reach out to our elderly, reach out to people who are isolated, because some people live in a walk up and they can't walk anymore up and down the steps. What can we do as members of this society to help others? So, you know, all of this is great, but if we don't get together and we don't continue to have these type of forums, we're just going to continue to be disconnected from one another and the pathways that could really be helpful to healing for all of us.
You know, it's interesting you said helping others. The Blue Zones talk a lot about helping others and giving more so than receiving. Listen, we're almost out of time. We can talk for a long time. This is something that I think that you know, thousands and millions of people really need to hear. But before we go, Gary, I'd ask that you like take pictures of the questions in the chat. So if we didn't get to your question in the chat, and members, we didn't get to all the questions that you had posted as well, hopefully, doctors, we can put those in a email, and maybe we can get those to our members because we didn't get to a number of questions. You all had such great answers. I didn't really want to cut you off. So I really appreciate you all doing this on behalf of the 100 Black Men New York City chapter, founding chapter, best chapter. We have a number of 100 chapters, but I think we're the best. I want to thank you. And in closing remarks, do you have anything that you would like to say to our audience, whether they're virtual and those that's live on Facebook? Thank you for joining us. We put this live on Facebook as well as being on Zoom. So for those that are joining us virtually, thank you. We are taping this, so it will be available for future reference. One thing I would like to say is that I heard a doctor say once, he said that your genetics load the gun, but your lifestyle pulls the trigger. So don't let it be a situation just because your mother, father, your grandfather, grandmother had some situation means that you can't change. You can change anything you want as long as you live a certain way and are willing to make those lifestyle changes. But for closing remarks, doctors, would you like to give our audience a closing remark about holistic health?
Anyone just goes?
Dr. Mincey.
Okay. Well, first, it's been an absolute pleasure to do this presentation. I'm an old member of 100 Black Men, the original.
I was going to get to that. Before we left.
And so it's nice to see that we had a program like this. I would just say to everyone that's here, really start off with the basics. Don't buy the genetic stuff necessarily. I think that's been echoed a couple of times. You also inherit diet and lifestyle, not just genes. So, and you can change those things. And I think the first thing you should do when you get off is take a piece of paper out and write down who your team players are, and make sure you have representatives from all aspects of the holistic health spectrum that we have presented. Stress is a big thing. There's different types of stress. Learn about it. Don't let it manage you. You manage it. To the next doctor.
Dr. Mincey, thank you very much. I was going to get that you used to be a member. We're going to make sure that past tense is no longer, that it used to be can become still will be, you know. Thank you.
Thank you. Yeah.
Dr. Costello, Dr. Gero, any closing remarks?
Look for like-minded people. If you're on a path of health and wholeness, then join with others who are on similar paths. If you're with a group of people that are hanging out every weekend, you know, going out and partying, obviously that's not the group that's going to get you on a path to a healthier lifestyle. So look at who you have in your inner circle and, you know, begin to build a community of people who are going to teach each other about nutrition, get together and exercise, walk, do other outdoor activities if you can, or take care of one another if you have to go visit people in their homes. There's exercises that people can do from a chair, but help one another, continue to be there for one another, support one another, and encourage one another towards a healthier lifestyle.
Dr. Costello, thank you very much. We really appreciate all of your words of wisdom. Dr. Gero?
I think we have to understand our internal GPS. And what I mean by that is to be able to understand what are our most important values in life. And values are something that you always strive to move towards, and you have to act towards those values. But unless you understand what those values are, you are living a life without any purpose. We have to understand there's going to be detours along the road, and we have to accept that there's going to be detours, but that shouldn't deter us. And we should be able to withstand most of the detours and circumvent those in respect of eventually moving towards our values. And if we're not moving towards our values, nothing's important in life.
Well, thank you for those words of wisdom as well, Dr. Gerald. It's always a pleasure of having you here. I'm going to send you a membership application too. We're having a gala on March 31st. Our first Vice President, Rob Brown, is with us. And if you did not get thank you for joining us, everyone. If you did not get your question answered, we would like to send out the questions to the doctors. Hopefully they can answer them and we'll send them out. Also, we're going to add the doctors, all three of you, with your blessing to our list of doctors. So if you want to get in touch with one of the doctors, then you can also do that. So they can can you just give your website or something real brief, Dr. Gerald, how could someone find you?
My practice is called the Holistic Naturopathic Center. I'm in Clifton, New Jersey. My website is holisticnaturopath.com. But if you look under Dr. Glenn Gero, you will find me.
Thank you. And Gero is Gero. Dr. Costello?
Yes, you can reach me at Zorina, ZORINA .Costello, COSTELLO at mountsinai.org. You can email me there and I'll answer you.
All right, great. Thank you. Dr. Mincey?
I put it in the chat. It's integratedhealthcare.us, and I'm in Montclair, New Jersey. And you can just easily type my name in and you'll find me, Dr. Tyran Mincey, on any search engine. I'm not high.
M-I-N-C-E-Y.
C-E-Y.
Thank you. Excuse me?
M-I-N-C-E-Y.
M-I-N-C-E-Y. I'm sorry
I put it in the chat. So if you look there.
Great.
Yep.
Great. So Rob Brown, our first vice president, if you'd like to please give us our audience a little information about our gala that's coming out, our big fundraiser. It's going to be absolutely wonderful at Jazz at Lincoln Center. Rob?
Good evening, anyone, and thank you to the great panel. I actually picked up some very good information, and I'm definitely going to add to my medical team, natural doctor. Anyway, as Reggie said, our upcoming gala is March 31st, be held at Jazz at Lincoln Center. Those of you on this medium right now are used to our normal annual gala at a large hotel in New York City. Is going to get a treat this year, so be ready for something different. Jazz at Lincoln Center offers us the opportunity to focus on, jazz as a medium that was really invented by Black folk, and we're really going to do a good thing with jazz, as using it as a medium to fundraise for our organization to continue to do great things for the young people in our community. So put on your calendars, March 31st, Jazz at Lincoln Center, our annual gala for the 100 Black Men Founding Chapter. Thanks, Reggie. Thank you very much. Hope to see you.
Thank you, Rob. And it's going to be a wonderful night of music. Giant Steps is our theme. So we're taking giant steps to make sure that our communities are better and everyone continues to move forward. March 31st at Jazz at Lincoln Center in Manhattan. It's going to be a great time. I want to also thank the committee, Health and Wellness Committee, Dr. Gary Butts, Dr. Reginald Miller, Anthony Smalls. I'd like to thank Gary Smalls for helping out, the office as well, Courtney Bennett, Dina Gardner, and as well as other members of the committee, Rudy Coombs, Charles Ruffin. And that concludes our evening for the night. We stayed right around an hour or so. We tried to be respectful to your time. As mentioned, if your question was not answered, we're going to ask Gary if you would take a snapshot or something of those, and then we'll try to get them to the doctors. We'll add the doctors to our list of doctors on our Google sheet, and that really concludes it. If you doctors, if you'd like to stay on for a minute and have an informal chat with anyone, we'll just open that up. But our formal presentation and talk, Fireside Chat for the 100 Black Men New York City chapter is over. I want to say thank you very much. If you want to stay on the line, you're welcome to do so. We'll leave it open for a little while, and then we'll close it out a little later. But thank you, doctors. We really appreciate this. This was a long time coming for holistic health. I'm excited. I think we all learned something new. I know I did, and hopefully all of our audience did as well. And thank you very much. Have a good night. If you want to stay on and ask a question,